I would like to present Professor Ashkenazi. Thank you so much for being here with us. Professor Ashkenazi is a professor is a full professor at the Dean Adelson School of Medicine in Israel. He's a professor at the Dr. and Miriam and Sheldon Adelson Medical School Department. He had his medical education and residency in pediatrics in Israel and his fellowship in pediatric infectious diseases in Houston, Texas. Is a member of the Israel Pediatric Association Council, is a member of the National Council for Child Health, and is a member of the Education Committee of the World Society for Pediatric Infectious Diseases. He's Dean of the Ariel University School of Medicine. I would like to give the floor to Dr. Ashkenazi.
Thank you, Silvana. Thank you very much for the invitation. It's my pleasure and privilege to be with you here and talk about telemedicine in pediatrics 2022. What have we learned from what lessons have we learned from the COVID-19 pandemic? And as you all know, I guess already, the severe acute respiratory syndrome coronavirus 2 crossed the species barrier, infected humans, leading to the huge COVID-19 pandemic. As of today, we have all over the world more than 500 million cases of confirmed COVID-19 cases. The real number is probably higher, and we have more than 650 million cases of death. So there is a significant morbidity and mortality. We have new variants. We already have 5 waves of the pandemic. And he's had a huge impact on the medical, psychological, social, economic, and political impacts. And today I will talk about the impact and mainly the lessons that we learn about telemedicine. Just for our convenience to start with, let's see the definition of the telemedicine. So this is the definition of the WHO: the delivery of healthcare services where distance is a critical factor for all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of diseases and injuries. And this is the definition of the Wikipedia. Telehealth is more broad, is the distribution of health-related services and information via electronic information and telecommunication technologies. So with this in mind, let's see what did we experience in telemedicine in pediatrics in Israel, and what were the effects, the significant effects, I would say, of the COVID-19 pandemic. So here we see the various components of telemedicine. We have telediagnosis and teletreatment, telesurgery, teleradiology, very important, increasing all over the world, teleeducation and teleconferencing, teletriage in the emergency room, and telesurveillance. In the 20 minutes I will talk mainly about telediagnosis and teletreatment, and then teleeducation, showing some studies that we have done. And finally, I just mentioned the telesurveillance. My dear colleague Ariel Benis will talk about it. I will just use it to demonstrate something very important. So let's start. The first study that I would like to explain and mainly emphasize the take-home messages is the study that was published, The Future and Telemedicine Visits After COVID-19, Perception of Primary Care Pediatricians in Israel, a study that was published in 2020 and till now has a couple of dozens of citations. So the background, I would say, should be clear. On March 15, 2020, during the first wave of the COVID-19 pandemic, we have a lockdown and quarantine that were imposed in Israel. Now, the lockdown and quarantine were really very strict. For instance, just to demonstrate, you can walk only 100 meters from your apartment or house, no more. Obviously, during that time, abrupt switch to telemedicine was imposed, mainly in ambulatory care, but partially also in hospital care. As head of Department of Pediatrics at Schneider Children's Medical Center, a tertiary children's hospital in Israel, we had in the department an area of COVID-19 children. They were not very sick, but this area we use a lot of telemedicine. We used to stay in the station, the physician station, and get information by telemedicine that I will explain. So this was the background. Now at that time, as the chairman of the Israeli Pediatric Association, we said, well, let's try to assess the use of telemedicine by Israeli pediatricians before and during the lockdown. Okay, but I think something even more important, let's try to estimate how will telemedicine be used as a medium of medical practice in the post-pandemic era. I would mention at that time we were optimistic. We thought that after the first wave of few months, we'll be after the post-pandemic era. Now, as an infectious disease specialist, I'm not sure when will be the post-pandemic era. But we try to assess what will be the impact that the COVID-19 will have in the future after we'll have no pandemic. Will we use more telemedicine, more sophisticated telemedicine? So this was the aims. And the methods, we actually use two components in our methods. One, we use the data from a big HMO, Maccabi Health Services, an HMO that actually ensured about 25% of the Israeli population. So this was one component of the study. Another component was a web-based survey distributed to all Israeli physicians in May 2020, soon after the end of the lockdown, the first lockdown. We thought that will be only one wave. And we asked the pediatricians by electronic questionnaire about the use of telemedicine before and during the lockdown. And in addition to the direct answer, we presented to the pediatricians two hypothetical clinical scenarios, one of acute pneumonia, and the other one was acute otitis media. And we asked what components of telemedicine will you use in the future and now to treat and diagnose these patients. And finally, as I mentioned, what are their expectations of their own use of telemedicine in the post-pandemic era? So this is the study population. We see that most physicians were younger than 67, 14% were older than 67 years. That's the official retirement age in Israel, although physicians don't retire, they continue to see patients. A bit more females, as well in pediatricians in Israel. Nearly all of them were board certified pediatricians. Most of them had between 10 and 30 years of experience. Most of them very experienced. And about 1/4 worked also in the hospital as well as in the community. We have a 40% response rate. I just will mention we have in Israel an online research group of pediatricians that we do several studies together, sometimes clinical studies, sometimes survey like this study. So this is the data from the Maccabi Health Services in Israel, taken from the computerized system. It's a very advanced computerized system. And it's interesting. We see here the personal visits, face-to-face visits. Before the lockdown, these are the numbers. We see percentages in a minute. So there were the numbers. This is during the lockdown. However, here the lockdown ended. And interestingly, still higher percentage are using now in personal visit, but less than in the era before the COVID-19. Lower numbers than before the era of the prior to COVID-19. Let's talk about phone visits. Before the COVID-19, when you try to schedule a meeting with your pediatrician, you couldn't do a phone visit. There was no such a possibility. Now here, there is the lockdown. So here there were no phones. During the lockdowns, after some short time, it increases. And you see, amazing, there is no lockdown here. There should be, as before, no phone visits, but still it became very popular, even higher than during the lockdown. So pediatricians continue to use the phone visits. And now let's go to the survey, the web survey that we used among our pediatricians in Israel. So we see here in all the data that I presented before COVID-19, during, and the expectations after COVID-19. These were only expectations or questions. What do they think? And we see, for instance, before the COVID-19, physicians used phone calls. It was not officially in the documents. There was no reimbursement for that. So about 48%, increased to 65%. This is significant. You see here the significance. After the COVID-19, it went down, but still it was about 10% higher than before. Using email, 24%, increased to 43%, and the same. It's lower than during the lockdown, but higher than before the COVID-19 pandemic. Text messages, for instance, by WhatsApp, increases from 23% to about 40%, and again higher. Using video clips or pictures, again like WhatsApp, was very low, 14%, 15% before, 40% during the lockdown, 26% higher after the pandemic will be over. As you see, this is significantly different than before. Before it was 14.8, now 26, nearly 2 times more, even when there is no COVID. Pediatricians are expected to use pictures and videos, for instance, of X-rays, rashes on the skin, and so on to make diagnosis. So clearly, after the COVID-19, the numbers did not go down as before the pandemic. And here again, with the website study, we ask how will you manage the scenarios that we'll present to you? And this it was a scenario of acute pneumonia. Again, before the COVID-19, what did you do? During and after the pandemic is over. And we said very clearly that before, very few used telemedicine components, any of these. During the pandemic, it was used much higher. And after the pandemic, again, it's lower than during the lockdown, but higher than the rates before the pandemic. So this is scenario number 1, acute pneumonia in a child. And this is acute otitis media in a child. And we see again before, during, and the expectation after the pandemic. There was certainly an increase in treating by the telemedicine, prescribing antibiotics. It was 1% only before. Pediatricians in Israel did not prescribe antibiotics without seeing the patients. During the lockdown, it went to 13.6%. After, down again, but higher than before. And the same here with the prescribing symptomatic treatment. So the conclusions are very clear. Use of telemedicine technologies by pediatricians in Israel increased substantially during the COVID-19 lockdown, but only partial decline in the post-pandemic era by both administrative data and pediatric expectations are seen. In other words, telemedicine in pediatrics is here to stay. It did not go down as before the pandemic of the COVID-19. Another study that we did as a dean of the medical school is looking at electronic distal learning that was imposed on us of preclinical studies during the pandemic, the first lockdown, a study that was done in our students. And again, we would like to see the future. So we asked what will be the impact on the future. So potential future impact. Just to give you again the background, because of the lockdown imposed on the 15th of March, preclinical studies were switched abruptly from face-to-face studies to electronic distance learning. Just 2 points to emphasize. Of course, we have dissections and we have a course in patient-physician relations. These were kept and done after the lockdown was finished. And obviously the clinical studies, that is not part of this publication. The clinical studies were stopped for some time and then performed. You cannot do distance learning for clinical examination of the patients. So this is the preclinical studies. Just let me mention one thing. As a dean of the medical school, all our students in the medical school, before any pandemic, we ask that every student will have a personal mobile computer. They have to bring the computer to the lessons. On the computers, we put several programs. So during the lessons, they could use the computer, see the MRI of the brain, turn it around, and so on during the anatomy course, for instance. And all the examinations before the COVID-19 pandemic, 2021, all the examinations were done electronically by the computer. You enter to the exam, it closed all other internet and other things, and you answer the questions. So we did not use papers. And in addition, another advantage that in few minutes, I could see the results of the examination and what the quality of each question and so on. So it was pretty easy now when everyone has a computer of the students. It was in one day we switched to electronic distance learning. And the methods, we did a survey, telephone survey, towards the end of the semester with 100 response of our students. When the dean asked them to answer, the answers were given anonymously, of course, but they all responded. And the results were very interesting. First of all, we asked about the satisfaction with the electronic learning during the lockdown. Overall, satisfaction was very high in 33%, high in 56%, so 80, 90% were very satisfied. They were satisfied with the quality of learning, the instructions given. Interestingly, technical assistance was appreciated as very good or good. 30% and 35% had high and very high interactions with the lecturers. By interactions, it was online, of course. By interactions, I mean asking questions, responding to questions, and many of them watched the recording. After, I didn't mention, after the electronic learning, everything was recorded and the student can watch it. And about 67% participated in most of the lessons. It was more or less the same percentage of participation in the face-to-face learning. And they viewed the recording, and as I mentioned, they had an active participation. Now, amazing, it was the first time that we did electronic distance learning. And we asked the students, what is your wish? What do you want for after the COVID-19 pandemic will end? What percentage of your preclinical studies in medicine, in the medical school, you would like to have online? Amazing, more than 90%. The students would like to continue most of the preclinical, it is preclinical studies, to continue online. Was high really above that what we expect. No one wanted to continue with 0 online. Again, 2 months before that, we didn't know, we didn't have the online electronic learning. We used the Zoom platform, mostly the Zoom platform. So, dear colleagues, again, we can say that teleeducation, electronic distance learning in preclinical studies of medicine is here to stay, and I can discuss afterwards. We use it even, continue to use it partially even after the quarantine was ended. And just last thing, I will not mention this study. I guess my dear colleague just mentioned here the study that was done in adult and asked what compared 250 examinations, comparing distance learning and distance examination and examination of a patient. And here they use, and we used also in pediatrics, the TITO system, in which you can examine the hearts and the lung sounds and the ears very clearly. I will not go into details, but the satisfaction of the physicians here, internists and others, were pretty high. This is the score from 1 to 9. 1 recommend to continue, 1 do not, and you see most are above 5. 5 is indifferent. So visualization of the pharynx, more than half said that with TITO you can see it very well. And so overall estimation, 6 more than 5. And this is, as I mentioned, the last study that probably my colleague Ariel Benis will discuss. Just to mention, when we ask in the internet the reasons for utilizing telemedicine, the one component I would like to mention, previous use of the internet was associated with using telemedicine. So I just brought it to mention that what do I do? What do I need for telemedicine? We need certain components for telemedicine that when we talk about the future, we should take that into account. So thank you very much for listening to this presentation. Obrigado to all of you.